Good info. Thanks, B. All right. Well, after a year of being cooped up, everybody's trying to get outdoors, right? Well, yeah, that's good in some ways, but it also means there's a lot more injuries happening, a lot more people heading to the ER. There's actually a chance you could skip going to the ER and still get same-day treatment.
Everybody who's dusting off the rollerblades they got for Christmas, or they decide it's time to get in shape again. Every year we see it, but this year especially, there's just been an explosion of people out there, recreation, new sports, new activities, and consequently we see a lot of injuries.
Dr. Trask-Muir is a surgeon at Peak Orthopaedics at Lone Star Hospital, and he uses state-of-the-art treatment for foot and ankle injuries.
Now this is exciting. This is the one place where in my career I've seen huge advancements in medicine and technology. You know, the traditional way of treating an Achilles rupture is a huge surgery. It's 10-inch incisions, 2 months before you can walk on it, high complication rates. I use a technique now where we can do it minimally invasively. So small 1.5-inch incision. I can get complete Achilles ruptures walking in 2 weeks. It's really exciting to see a patient out there in rehab and just doing so well, getting back to sport so quickly.
Dr. Muir treats all kinds of sprains too, from people hiking, mountain biking, and climbing. So when do you know if it's an injury you shouldn't just walk off?
But it's those times where you can't put weight on it. If you can't stand on that ankle, you should probably be seen.
Hand and wrist injuries are also very common for people who are active outside.
We see these types of injuries year-round, but it does seem to be associated with mountain biking, running, being on the trails. The majority of these injuries are accidental, unavoidable. You know, certainly people pushing the limits on the trails can put them at risk, you know, jumps and things like that, but for the most part, fractures and injuries like this are unavoidable.
Dr. Brian Mackey specializes in those hand and wrist injuries at Peak Orthopaedics at Lone Peak Hospital.
Treatment options for injuries, you know, go anywhere from rest, ice, compression, elevation at home to immobilization, casting, and different surgical interventions.
Again, you can skip the wait at the ER and get treatment quickly at Peak.
You know, when you've had an injury, time matters, days matter. And so the last thing you want to hear is when you call up the doctor and they say, yeah, we can fit you in, it'll be 3 or 4 weeks. That's too long, that's too long. So here at Peak Orthopaedics, we have a protocol, we have a program for these people with acute injuries. We can get them in within 1 or 2 business days at the latest, sometimes the same day.